I'm Dr. Bill Berkowitz of Life Chiropractic. Let's talk about sciatica, and let's talk about the 4 top keys to successful sciatica treatment. Sciatica is not only a pain in your leg, but a pain in your you-know-what. You want to get rid of it as soon as possible. It is miserable. It makes it difficult to sit, to stand, to walk, to bend over, to do about anything, and sleeping can be brutal. So you want to resolve it. So here are the 4 keys. Number 1 is accurate diagnosis. You really want to make sure if you have sciatica that you approach this carefully and cautiously. You want to get an MRI to make sure that there isn't what we call a space-occupying lesion. That would be a bone spur or a disc or something else that's putting direct pressure on the sciatic nerve. And if it was a disc, then you certainly don't want to get chiropractic care in that area. Number 2, assuming that that's all good and we don't have any profound weakness, then we want to look to balance the structure. We want to make sure that your pelvis is level as you sit and walk. We want to take as much stress off of that area and put the sciatic nerve in a state of relaxation or ease so the inflammation can go down. Number 3, we want to make sure that your pelvis and your lumbar spine joints are moving. Joints have a purpose, and that is to provide movement. And if those joints are not moving, then it's really easy for that sciatic nerve to be put under extra tension, get inflamed, and cause pain. And number 4, we want to take care of movement and posture. Especially recovering from sciatica, you want to make sure that you move in certain ways that do not put added stress on that sciatic nerve. You need to learn really simple ways of bending, simple ways of standing and sitting that avoid putting excess stress. Quite often we adopt postures and movements that are simply aggravating to sciatica and to our spine, and that's often why we get in that position in the first place. Just one caveat. If you do have sciatica, if you ever experience a loss of bowel or bladder control, it is an emergency. You dial 911, you go to the hospital right then. Do not wait, because that is a surgical case. Other than that, lots of sciatica really isn't sciatica. So the first thing we really want to find in the diagnosis is it sciatica? Just because you have pain in the leg does not mean that it's sciatica. If it's not directly down the back of the leg, it likely isn't sciatica, and that's a good thing. It tends to be a lot easier to deal with than sciatica. Make sure to subscribe to my social media channels. Check out my website, lifewithinchiropractic.com. Thank you.